Hello, I'm Deborah Sullivan, the Injury Prevention Coordinator at Lahey Hospital Medical Center Trauma Service, which is an American College of Surgeons verified trauma center. We track injuries to try to identify patterns that we can impact to improve the health of the population we serve. We are here to talk today about ladder safety. Last winter's record snowfall created the perfect storm with unsafe weather conditions, improper use of equipment, especially ladders, urgency in just doing the task of snow removal without the proper planning or knowledge to do the job safely. This led to a record number of injuries in our area. This program on ladder safety is a collaboration with Burlington Fire Department, O'Connor True Hardware Store located in Billerica, Burlington High School, and the Lahey Hospital and Medical Center Trauma Service. You will hear from Michael Rosenblatt, Director of Trauma Service at Lahey, as he discusses patient issues related to falls from ladder. First of all, Dr. Rosenblatt, what types of injury patterns are related to ladder falls or falls from roofs? What type of injury patterns do you see?
Most of the injuries are related to the extremities or the pelvis, and that's because people are trying to keep themselves from landing hard as they fall, and they put their arm out or they try to land on their leg, and when they land on their leg, they drive their leg up into their pelvis and they can fracture their pelvis. But in addition to those, we see much more catastrophic injuries, such as injuries to the chest wall, where people can land on their chest and break multiple ribs, which will cause them to have difficulty breathing, and many of these patients end up in the intensive care unit on ventilators because of that reason. And then the ones that are the most severe, the most tragic, obviously, are those patients who injure their head or their neck, because if you break your neck, that's a pretty irreversible situation, and if you injure something inside your head, it also can be a real problem for patients.
So there are a lot of hazards related to ladders and climbing on ladders. I mean, you really have to be in good condition to climb on a ladder, and certainly strong enough to lift a ladder, and have your wits about you to really be cautious when you're climbing a ladder.
Yeah, I would think that if you were trying to decide whether it was safe for you to be up on a ladder, the first thing would be, can you even lift the ladder? If you're not strong enough to lift the ladder and have somebody else put that ladder in position, you're probably not the right person to be going up that ladder.
Right, thank you. What's the impact of these injuries, these severe injuries on the patient, on the families, on society?
Sure, there are a number of impacts, and those can be sorted out among just recovering from these kinds of injuries. These injuries can take years to recover from if they occur in specific places and you're able to recover from them. And there's enormous cost. If you look at nationally, 500,000 people are injured annually each year, and the financial cost in 2010 for those 500,000 people was $24 billion, and that's work loss and medical and legal and liability and pain and suffering expenses as well as that. Interestingly, most of these injuries are not due to work-related injuries. These are due to recreational or home use. Only 34,000 of the 500,000 injuries actually occurred in the workplace. And of those 34,000, there were 113 deaths. And if you extrapolate that to the home use or the residential use, we're seeing over 1,500 people a year die nationally from these kinds of injuries, and that's the ultimate cost.
Can you give me a description of a person who should never climb on a ladder?
Yeah, sure. I think that patients who are on blood thinners, and we see more and more patients on blood thinners each year, and that has to do in part because physicians are recognizing that there are conditions that are probably better suited for blood thinners, such as irregular heartbeats that could, if not treated, lead to a stroke, which is a pretty devastating injury. Those patients are on anticoagulants, and I would think that the mixture of climbing up a ladder and being on a blood thinner is probably the number one combination that one should avoid. If you're on a blood thinner, you shouldn't be up on a ladder. The other groups of patients that I think that are really at risk are those patients who already have some type of dizziness walking on the ground. They really shouldn't be up on a ladder because being up on a ladder predisposes you to dizziness. The inner ear is responsible for controlling that, and if you already have an inner ear problem, when you go up on a ladder, you just exacerbate it. And then finally, I think patients who have previous episodes of blacking out for whatever reason, they really shouldn't be up on a ladder.
Okay, thank you very much. Can you tell me a little bit about the trauma service and
Sure.
the role within our community?
Sure. The trauma service was initiated in 1997, so we're inching up on our 20th year serving the community. And the trauma service is a combination of all of the clinical services that are responsible for care of the injured patient. And obviously, in your role, trying to prevent those injuries, we'd much prefer not to have patients coming to our center. But if we have to be there for them, we're organized in such a way that from the moment, even before you arrive, we're notified by our pre-ambulance or pre-hospital personnel to let us know that an injured patient is coming. That triggers a response that you normally don't see in a trauma center. And we're coordinated in our care through the emergency room, through the operating room, and our imaging units, on to our intensive care units, the operating room, our med-surg floors, and then coordinated with our care with our rehabilitation facilities and our visiting nurses. So it's really from start to finish, we try to coordinate the care so that we're looking for the best outcome for the patient. Our goal really is to see that at least 90% of our patients who are injured are back in whatever condition that they were prior to their injury within a year's worth of their time. And we keep very good track of those, and we do a pretty good job of that.
Okay. Of those patients that died, you know what the age ranges are?
Sure. The average age of our patients that fell off of ladders, and we had over 250 patients in the last 7 years who were admitted to our trauma service. That doesn't count the patients that came to our emergency room and were discharged from the emergency room. The average age of those patients was 57, and most of those patients were male. Again, 88% of these patients were not involved in a work-related accident, and we only had one death in that period of time, and that was from a severe head injury. But interestingly enough, these were not subtle injuries. Almost a quarter of them ended up in the intensive care unit, and nearly 10% of them were on a ventilator for a period of time. So these are not trivial injuries, and best to try to avoid them altogether.
Thanks, Mike. Now to O'Connor True Hardware Value Store, where you will be provided with information on ladder safety from Mark Saia and see a demonstration on safe ladder techniques by our Burlington High School students Julio, Tim, James, and Joshua, as guided by firemen from Burlington Fire Department. You will learn about the different types of ladders and their use from Michelle Cloutier, a representative from O'Connor Hardware.
Well, you need to know how far up you need to reach.
So the size of the ladder.
Size of the ladder. Weight-wise, there's different classes. So depending on your body weight, it goes up to 300 pounds. Each ladder has a rating on it that is either like a 1A would be a 300-pound rating. The different colors stand for different weight classes.
Oh, okay.
So a yellow would be a 250-pound rating.
Okay.
Green is 225, and the orange is 300.
Okay.
I mean, a standard two-story house probably need a 24-foot extension to reach the very peak of it. Well, whether or not you can carry it yourself, too, just because it will reach, can you handle it, carrying it to the spot and getting it in place? A fiberglass ladder would be the safest. It's just not a conductor.
Okay. How do I identify a fiberglass?
It's not the metal one, it's one that has color. A tool belt. A stabilizer for the exterior painting if you're going to go over a window.
Okay.
That way the ladder's not resting right on the house either. Keeps it away a little bit.
Sure, so some of the indications or some of the situations where you would probably not want to go onto a ladder is if you have a history of vertigo, if you get dizzy spells, if you are someone who may be afraid of heights, if you have an underlying injury, and if you should be in relatively good shape, because climbing a ladder in itself, it can be very stressful. And in addition to that, whatever task that you're using to use the ladder for could also be very stressful as well on the body. So in relatively good health and just overall feeling good that day. There's always a concern when people who are on blood thinners about any types of falls or bangs or bruises that the bleeding could be more extensive than it normally would for somebody who would not be on a blood thinner, and more difficult for the bleeding, for us to control the bleeding on the EMS side of things. So I think some of the things that we see is things like not choosing the correct ladder for the job at hand, the improper placement of the ladder, that the ladder was either too low or too high for the job that is being done, that it wasn't properly placed on the ground or a firm surface. A lot of the times we'll see that, especially in the winter, that the bottom of the ladder will be placed on some ice or some snow, and that'll cause the ladder to slip. In addition to that, I think that a lot of the reasons why people fall off of ladders is they try to reach too far. At any given time, there should be at least 3 points on the ladder, meaning both feet and at least one hand. If you need to take more than 3 points off the ladder, then the ladder either needs to be changed or the ladder needs to be moved closer to the job at hand. Because if you can't keep at least 3 points on, then it's too much reaching, and then now the center of gravity on the ladder will be off, and there will be the ladder could tilt or you could slip off. It's best if any tools that you have, to make sure that you either carry them on a tool belt and that you have both hands clear in order to climb the ladder. You should be, when moving on the ladder, either climbing up or climbing down, both hands should be available to grab onto the rungs. I think one of the most important things to consider would be to make sure that you have a spotter, that you never go up on a ladder alone. Because the spotter can give an idea, because when you're on the top of the ladder or on the ladder, you kind of only have the vantage point of where you are and what the task is at hand, where the spotter can not only stabilize the ladder but can take a look around, make sure there's no objects falling or that the ladder's not slipping, and can make sure that the rungs stay locked and that the ladder stays in place. So obviously, one of the biggest things, as we previously said, is to make sure we have a spotter. And obviously the spotter is going to we want the spotter to not necessarily move the person, but to make sure that they summon local EMS and keep the patient calm and warm, and get them out of harm's way. If it was an accident because of falling debris, make sure that they're safe. You want to make sure that you go at least 3 feet above the top of where the object that you're looking at. So if it was on top of a roof, you want to make sure that the ladder extends at least 3 feet over the roof. You want to make sure that you have the correct angle of the ladder. And in regards to the correct angle of the ladder, it should be for every 4 feet that you're going up, the ladder's angle should be at 1 foot out. So, for example, if you're going 8 feet to an area such as the roof, then the bottom of the ladder should be 2 feet out from the house, for example. In addition to that, you never want to go on the top 3 rungs of the ladder. So, if you need to do that, you either need to extend the ladder more, or you need to get a bigger ladder. And to make sure that the ladder is, you don't want to hit any power lines. You want to always look ahead for obstructions, and again, make sure that you don't that the ladder itself is not slippery, it's not wet, it doesn't have snow on it. All those things could cause a serious fall. So the top point on the step ladder should be kind of reserved for maybe putting an object such as a ladder or a tool or maybe a can of paint, but not to be stepped on. And again, that rule applies to if you have to climb above the third highest rung on top, then that ladder is probably not the correct ladder, and to choose another one. The Occupational Safety and Health Administration they produce guidelines and safety regulations for most all tasks, and so they would if you were to Google OSHA and ladder safety, they would be able to they would have information on that. So I think a lot of it is asking the professionals and asking the people who are in the know. For example, if you had a task at hand that you wanted to do, you could come into a place like this, a business like this, O'Connor Hardware, who actually have people who are educated and will be able to let you know whether or not you're choosing the right ladder for that task, and they could help you choose it. In addition to that, they have the ability to show you how to use it. So it's finding out where your resources are and utilizing the people that can help you.
Well, that was the indoor portion of our segment. Now we're going to take this outside. Lieutenant Saia, could you tell us what's going on with the ladder here?
So we are having firefighter Sean Connors and firefighter Kyle Brown show us how to choose the correct ladder and set it up. So the first thing they're going to do is set the ladder up using something called a beam raise, which you can see Sean is raising it by the beam. And then they're going to make sure that there is no overhead obstructions, no wires, and that the overhead is clear. And you can see that Kyle on the right is making sure that the ladder is stable and steady while Sean raises it. And while Sean is raising it, he's looking up to make sure that there's no obstructions. He's also going to try to judge how high the ladder has to go. And then at that point, once the rungs are locked, he's going to tie it off. And now the ladder, as a team, they're going to lower the ladder onto the building. And at that point, they're going to be looking to make sure the angle is correct. Again, that it's not too steep, and that approximately for every 4 feet going up, it's 1 foot off the bottom, is 1 foot off the building. And you can see Kyle's feet are holding on to the rungs of the base of the ladder, and it's on a steady surface. At this time, we will have Sean and Kyle dictate how and narrate how to actually climb a ladder using our volunteers from the high school. And you can see he's taking one rung at a time. He's looking forward, straight ahead, not up or not down. And he has using the rungs, using one hand at a time. Making sure that he doesn't go anything above the third highest rung. And you can see his spotter is making sure, is looking at him and looking at his surroundings, making sure that everything is stable. Same thing on the way down. He's looking forward and using one rung at a time with his feet and using one rung at a time with his hands.